to our, let's try it again. Good morning, everyone. Welcome to our grand rounds, the February grand rounds here from the Osher Center for Integrative Medicine at Harvard Medical School and Brigham Women's Hospital. We're really excited and delighted to have all of you here, and we'll just get started with our presentation in just a moment, but a few announcements before we do that. First, for those of you who are desiring CME credit for these grand rounds, we'll send an email to Esme, and that information we put in the chat in terms of how to obtain grand rounds. So please, yeah, so that's one thing. Second, we wanted to just alert you that in November 10th and 11th, we'll be hosting our biennial Integrative Medicine Network Forum, and this year's theme will be the lived experience of depression and integrative approach. Really, we're looking to talk about and have discuss cutting edge work on depression. As many of you know well, that this is such an enormous public health issue, and we've been lucky to have secured several luminaries in the field, including Dr. Vikram Patel, who's based here at Harvard Medical School and the Harvard School of Public Health, Dr. Maurizio Fava, who's the chair of psychiatry at Massachusetts General Hospital, and Dr. Greg Frachon, who's the director of the Benson Henry Institute for Mind-Body Medicine as well. So amongst many other, and Dr. Maggie Alegria, who's also professor of medicine psychiatry at MGH as well. So we really, and that's just to name a few. So we're really excited for this forum. So stay tuned for those details as well. With that, so my name is Darshan Mehta. I'm the education director for the Osher Center for Integrative Medicine, as well as the medical director for the Benson Henry Institute for Mind-Body Medicine. And before I introduce our speaker, just as many of you know, we host the grand rounds the first Tuesday of every month. Next month's grand rounds will be on Tuesday, March 1st. It will be by Michael Ferguson, who's at the Center for Brain Circuit Therapeutics at Brigham Women's Hospital, and his talk is entitled Clinical Neurospirituality. So another, again, exciting talk as well. So with that, I'm really delighted to introduce Dr. Michael Spertus. Dr. Spertus completed his residency in family medicine at New York Presbyterian Hospital and Columbia University, and a fellowship in integrative medicine at the Institute for Family Medicine at the Mount Sinai Icahn School of Medicine. He's board certified in family medicine, integrative medicine, lifestyle medicine. He has obtained multiple trainings, including clinical hypnosis, mindfulness-based therapies, behavioral medicine, and acupuncture. He works now at the Marino Center for Integrative Health at Mount Auburn Hospital as an instructor in medical school here at Harvard Medical School. And really is providing comprehensive integrative primary care and does integrative medicine consults as well. I've gotten to know Michael over the past year and really excited when we when we have new colleagues amongst us, and we're really excited to have him amongst our Osher Center network and family. So with that, I will pass it off to Michael.
Thank you, Darshan. I'm just going to share my screen here, which hopefully pulls up the slides correctly.
Oh, and as you're doing that, just for the audience, please do put your questions in the Q&A, and we'll be sure to address them at the end of the presentation.
All right. So thanks again, and thanks for having me today. Today, I'm going to be going through my presentation entitled Quieting the Mind, Harnessing Integrative Medicine in Primary Care. I'll be going through a case, which I'm really excited to go through with you all. And Dr. Neeti Jha, who I'll introduce more formally a little bit later, will be the discussant. I have nothing to disclose. As far as learning objectives, by the end of this presentation, I hope at least that you'll be able to describe the role of integrative medicine within a primary care setting, evaluate the benefits of a multifaceted team approach in primary care using an illustrative patient case, and be able to assess different models of integrative medicine care delivery. So first, I'd like to start with what is the importance of primary care, which is probably no surprise to most of us in this audience that primary care is important. Here, I gave an editorial here from Dr. Ada Stewart in 2021 in July from the American Family Physician that discusses how important primary care really is, and yet it's not really emphasized. As many of us know, the United States spends an extreme amount of money, over 2 times more per capita on healthcare than many other industrialized nations, and yet the health outcomes are substantially worse. The healthcare system in the US has spent over $3.8 trillion annually on healthcare more recently, and the large majority, which is on chronic disease and mental health conditions, with a population that's becoming less healthy. So unfortunately, for many different reasons, our healthcare system is not prioritizing primary care, and it should be. And we'll talk about that in just a moment. So another excerpt from this, to relate this more to our current situation, as we all know, with the COVID-19 pandemic, just a part of the excerpt here. COVID-19 further exposed the flaws of our healthcare delivery and payment model, including its exacerbation of significant health disparities. And I won't read the rest of the excerpt here, but the key point is bolded in the bottom: we can and must do better. So the importance of primary care, why do we know it's important? There's been a lot of studies showing this in both the US and internationally. Primary care is proven to produce better health outcomes, increase evidence-based prevention interventions, and reduce healthcare costs, which is most important to some. The report that I have listed there, the Patient-Centered Primary Care Collaborative Report from a state-level analysis, demonstrates in particular that primary care utilization and increasing access to primary care services helps to decrease costs, decrease hospitalizations, and to decrease emergency room usage. And there's another study with an interesting statistic as well, showing that for an increase in 1 primary care physician for 10,000 people, deaths are reduced by more than 5%. So this has true health outcomes, true real life outcomes for prioritizing primary care. And why is this important from the healthcare landscape? So this slide from the American College of Lifestyle Medicine shows what this looks like. Chronic disease is what's running rampant right now. 6 in 10 Americans have chronic disease. 4 in 10 Americans have 2 or more chronic diseases, some of which are mentioned here and are increasing. 38% of Americans will be diagnosed with cancer during their lifetimes. Half of Americans have cardiovascular disease. 1 in 3 Americans has prediabetes, and 72% of Americans have overweight or obesity. Pain. So chronic pain, one of the things that, of course, integrative medicine is used very commonly for. People are living with lots of pain. More than 30% of Americans are living with some form of chronic pain, with information from the CDC, and that's actually more than from cancer, heart disease, and diabetes combined. Stress. So we all know that stress is a problem. I love this Time cover from 1983, actually, which was showing us that stress was becoming an epidemic then. So clearly things haven't changed enough. And here we are from 2020, discussing the role of the COVID-19 pandemic once again from the APA. And I'll highlight the bolded part here. We are facing a national mental health crisis that could yield serious health and social consequences for years to come. So the current health system really, it doesn't emphasize primary care, and the health landscape for which our healthcare system is designed to treat isn't doing a good job treating the things that are most important and most running rampant right now. So this is where integrative medicine can come in. I like to use the definition from the Academic Consortium for Integrative Medicine as it really describes the approach that we use in primary care and more generally. The way that it's defined by them is integrative medicine and health reaffirms the importance of the relationship between practitioner and patient, focuses on the whole person, is informed by evidence, and makes use of all appropriate therapeutic and lifestyle approaches, healthcare and disciplines to achieve optimal health and healing. Here is an article, and really the title is the most important piece here. I agree, integrative medicine should be a vital component of patient care. The approach really is to incorporate the entire landscape. So the patient's mind, spirituality, sense of community into the healing process as well, which has been so separated from conventional medicine. And as well, the demand has been increasing for integrative medicine in general, for the many tools that it has to offer that the conventional health system does not seem to do a good job with. But where to find integrative medicine? So this is where the problems start to set in. Integrative medicine is really a subspecialty in and of itself and quite disparate in the tools that can be available. There are some even potential drawbacks of integrative medicine. So one is that treating with multiple different tools, different therapies often require multiple visits, multiple teams that might disagree on different treatments. There are also different costs. There's different sense of education about what integrative medicine is, and they're often just not found together. So some of the problems, as I just mentioned, primary care as a whole in our health system is being de-emphasized. High interest exists for integrative medicine therapies, but it can be very difficult for patients to access. And part of that access issue is that it can be expensive for patients. As mentioned, there's a lack of education on both the generally conventional providers of medicine, as well as on the behalf of patients who might not be familiar with what integrative medicine therapies can offer. And as such, the care can be quite disjointed and difficult to actually implement in a real world setting with our health system. So with that introduction, I'm very happy now to transition to our case discussion today, which is really, I think, the most important part of this session to really get a sense of how we can combine integrative medicine within the primary care setting. So I'm very excited to introduce our patient today, Chris, who has so gratefully decided to join us to go over his case with us. Chris established care with me as a new primary care physician in February 2021, having stress and difficulty sleeping. And I'll let Chris take it from here. So Chris, if you can please explain your story and experience and what brought you to care, and just in general, if you can tell me what was going on for you at that time. And I think I will unshare my screen so we can see you a little bit better.
Okay, hi, thank you, Dr. Spertus. Before I came to you, I was suffering from different sleep issues. I wasn't sure exactly what was happening and why I was waking up in the middle of the night. So I'd fall asleep typically and then wake up in the middle of the night. And this had been happening for years and years. And I had a primary care doctor at the time, and we started to explore it. And I was using different specialists and trying to figure out what's the problem. So I did a sleep study. There was no sleep apnea or anything like that. But besides that, we couldn't really pinpoint anything, and really the help didn't go any further. So I was kind of left on my own, reading books, doing the best I could, using over-the-counter sleep aids at times. And I wasn't happy with those. They would leave me groggy and cloudy the next day in the head. So I decided to start exploring and seeing what I could find. Now, when I was looking around for different centers, we looked at the Marino Center because my wife had been using the Marino Center. So great recommendation. She liked having a lot of different providers in one place. We both like the blending of Eastern and Western practices and philosophies, and also integrating the body, mind, and spirit approach, treating the whole body, as you said. So it was really out of frustration and somewhat desperation, trying to get a good night's sleep. And then, of course, with the pandemic, many people have been having trouble sleeping. Stress was getting piled on, work, busy life, middle-aged male myself, but I think everybody is feeling some degree of it. So that's what brought me to you.
Great, thanks for sharing that, Chris. And I'm going to ask you just a few more questions so that we can get a sense of how the experience went for you. So you mentioned why you sought care at the Marino Center. And is there anything that led you to choose it apart from your wife's recommendation, knowing that it was a center for integrative medicine, specifically apart from just to say a provider to be offering integrative medicine therapies?
Absolutely. So having the whole team of people available, again, with the blend of approaches, I thought that would be a very good way to get more attention. I felt like I was just drifting through the system previously, and to have a lead yourself, but also a team of people available in one facility it just seemed very beneficial.
And so if you can describe now for me and for the audience, which integrative tools did you end up using with me through the Marino Center, and what and how have these been helpful or useful in some way for your conditions, or at least what has your experience been with them? So how has your condition been affected by them?
Okay. Yes. So I was practicing mindfulness previously, and that's one thing that caught my eye was, especially with your background in that. So I signed up for the mindfulness training in primary care program, went through that 8-week program, learned a lot of new tips and tools that I could use and start to apply on a daily basis. So that helped enhance my mindfulness practice. And that's, for example, tuning into the senses, listening for sounds, focusing the mind on different senses, doing body scans, breathing, a lot of breathing exercises, and also some reframing. So that was all helpful. The most important piece, I think, of the sleep issue was the CBT for insomnia that you were treating me with. And that's been very helpful to reframe negative sleep thoughts and turning those into positive sleep thoughts, and allowing that to help calm the mind when falling asleep, but also if I wake up in the middle of the night, and not creating that resistance that can actually slow down the re-entry to sleep. And that would keep me up for hours previously. So using that CBT insomnia has been very helpful. And that has a clinical hypnosis component that we added there. And that has been extremely helpful. I've been listening to it each night, usually to fall asleep. And I drift into a peaceful sleep. I might hear about 2 minutes of you at this point before before going in fully. So that's been very helpful. And I'm getting full night's sleep now without any sleep aids, without any medication. And if I do wake up to use the bathroom, I just come back and fall asleep quickly, and getting full restorative sleep. And it's wonderful.
Great. And that's great to hear. And I think, we discussed more recently that some of those changes are quite recent, especially with the lack of need now to use medication as an aid, which I think is a really great and amazing progress that you've made. And I'll be discussing a little bit more about some of the specific tools that we use too. So thanks for sharing that. And I'm so happy again to hear the success with your case. I just wanted to get a sense to a couple more details about some of the intricacies here of the experience for you. So what has been your experience having me as your primary care physician be able to provide these services, as say to go to several different people who say provide MTPC or hypnosis or CBTI?
So it's incredibly convenient, for one, since I don't have to go around to different facilities and providers and get caught up on the different experiences with each. Even if they're sharing charts and other information, there's a lot of nuance to be communicated. So just to have continuity is really helpful. It's reassuring. It feels reassuring and feels good to have a single point of care, and you with the full breadth of what's happening right now as far as a case or with my life and any issues that are coming up. So I find that very, very beneficial and very reassuring.
Great. And one more question for you, and then I'll go into some of the specifics of the case too in a little bit, is the interesting thing about some of this, for me at least, is that so almost all of our visits since I even established with you have been entirely remote and virtual, mostly due to the pandemic and also due to changes in some of the practice. So how has that been for you? How have you felt that's affected the care in any way, or what's been your experience having virtual visits?
Again, there's a huge convenience factor not having to hop in a car and drive to the office and sit in a waiting room. Sometimes it's nice to have a break and break the routine and do that, but it's just to have so many meetings as we've done in the past year to actually solve what was a serious issue for me. It wouldn't have been feasible driving there all the time, especially from a North Shore community and dealing with traffic and all. So having a remote, I think it's amazing how we're able to do this today. To not only communicate information, but connect, to do other kinds of healing work. I think that, well, luckily the telecommunications and other things are able to provide this video now the way it does. So yeah, I think it's very effective, and it has absolutely made a difference in my life.
Great. Well, thank you for that, and thanks for sharing so much about your case. I'm going to pass this over to Dr. Jha now and have a discussion with her, as she was also involved in your care, particularly with the mindfulness training primary care. So just a brief introduction for Dr. Jha first. So Dr. Jha, who's my colleague in the Marino Center, she trained in internal medicine at Lincoln Medical Center and Mental Health Center in New York City, currently works as a primary care physician at the Marino Center for Integrative Health with me, and I'm very glad to work with her. She loves to bring the integrative medicine techniques of mind-body medicine into the primary care world. She has enhanced her training further through different mindfulness-based interventions like mindfulness-based stress reduction, mindfulness self-compassion, mindfulness training in primary care, mindfulness-based cognitive therapy, and lifestyle medicine through Harvard Medical School. So thank you, Dr. Jha, for joining us today.
Thank you, Michael. It's a pleasure to be here.
So I would like to, ask a different perspective here, apart from Chris as a patient. What has your experience been in providing some of these integrative services, in particular, mindfulness training in primary care for the purposes of this case? And then we'll discuss a little bit more generally also. So first, how did you become interested in offering mindfulness programs and MTPC, mindfulness training in primary care?
Mindfulness, having a personal mindfulness practice, I had always been very keen on seeing how we can bring it into everyday life for our patients to help them. And it's interesting, 2 years ago in February 2020, we were at an Osher Center conference. And these conferences are so special and heartwarming because we learned so many things. I think February 2020 was the day they were presenting mindfulness training primary care from CMC. And we both attended it, and we decided to go ahead and train and start those groups at Marino Center. And now it has been a good journey, and I feel today it's like coming a full circle, coming back to Osher Center to talk about the groups that we are running at Marino Center. So I think mindfulness training for primary care was one of the first mindfulness groups that we started at Marino Center. And it's amazing. It's a deep sense of fulfillment as a primary care physician to be able to bring to our patients what we feel aligns so deeply with our own core values. And we see benefits in our patients' lives. And it's a wonderful way to connect with our patients.
Right. So I have a question too. If you could describe your experience delivering MTPC specifically with Chris and with other patients. So how has the actual experience of delivering it been for you, apart from, say, your other primary care work?
So the group visits, when we were leading with the group that Chris was in, that was our first MTPC group. And it was a very special space that we shared with our patients. And I think the first few visits, Chris brought up this point that he had never spent so much time and had so much open communication with any of his PCPs in the past. And that thought stayed with me. And I said, yeah, we are not able to spend the time understanding each other's perspectives in regular primary care visits, because we have a 15-minute visit, we have to address the hypertension, the diabetes, whatever other chronic conditions are there, and then we have to move on to the next patient. Here in the group visits, the diagnoses that we are dealing with are similar, and the interventions are similar, and there's great communication, there's inquiry-based learning. So there's a two-way learning going on as we are asking questions, as we are practicing. The leader is practicing with the other members of the group. So the patients are learning and the physicians are learning. And I think it helps patients more than just a prescriptive visit.
Right. So really a different sense of what we're used to from the standard model. And as I always talk about, the power of the group, which I'll be bringing up in a little bit too. How do you feel that facilitating group visits, any of the group visits that you've helped facilitate, and in particular virtual group visits, have been helpful for your own patients? So you as primary care physician.
As a primary care physician, we want certain outcomes. We want chronic medical conditions to improve. And the groups that we are leading, initially, we weren't sure how the virtual form, how the platform of Zoom would work. But just sitting with the difficulties, the beginning trouble with making sure everybody is online with the technology, we are all on the same par. So I think it works well and it's convenient for patients. Everybody, irrespective of how far or how close they live to Marino Center, they have access to these visits. They don't have to be physically in the office, and still they are gaining from the community that we are building. And we are learning the skills of goal setting and decreasing the gap between the goal setting and implementation. When we're talking about setting intention, we're also teaching in these group visits skillful means to get to those goals. In a regular primary care visit, we're talking about low-carb diet, plant-based diet, but it's more of a prescription that we're giving, and we're not telling people the basic principles of mindful eating. How do we sit with that difficulty? How do we notice the comfort eating? How do we step back? And in the groups, we're able to work on each thing, each hindrance that comes up. We sit and we work through it.
Okay, thanks, Dr. Jha. And so really out of necessity, we had to do these virtual groups, and it's really been a boon for us. And I think has increased access in a lot of ways too, and convenience for both patients and ourselves, I would say, as well, to be able to offer that. Although hopefully we'll be able to offer some in person in the near future, but time will tell. One more question, just about the team approach, how that has been and how that's also been different from other types of primary care practice that you've had involving other team members.
Our teams are bigger now, and we asked for more help, and we did get it. And our team, starting from our office manager, our administrative assistant, our medical assistants, we have a resident nurse on our team. They all help us with the initial recruitments, And we also have a recruitment team helping us from Beth Israel. So there are all these people who have to come together. It's like the cog wheels fitting into each other and working the machine. And knowing that we are dependent on each other and we can depend on each other. We can ask for help and people come and help as much as they can. And then the thing starts rolling. We're able to do it because we have each other, we have our team, we have mentors, we have friends who come and stop by and suggest if we need suggestions. We reach out to the Mount Auburn Hospital setups, the technical parts where we have trouble. And I think the whole system comes together when they feel that it's worth the time and effort that we are putting in, because it's helping physicians as well as patients, everybody come together.
Well, thank you so much, Chris and Dr. Jha, for sharing your experiences with us, which have been so helpful and really describing how it is that we at the Marino Center or in general can provide integrative medicine therapies in a very different way from conventional primary care. And so I'm going to go ahead and share my screen again and continue on with some of the highlights of the case. So some highlights that came out and just some general discussion points in general. So one of the key things is that what Chris came in with are actually quite common concerns as we go to stress, especially with the pandemic, has been very much on the increase, although has been for years. Insomnia, we hear about COVID insomnia, and just insomnia in general has been very much on the rise. Up to 35 to 40% of the adult population in the US may suffer from sleep disturbances. And while these are common, they can be actually very difficult to manage. Stress, insomnia, and other related mental health concerns as well. And there's a lack and a saturation at the same time of mental health care resources. And these can be very difficult to manage in a standard, very volume-driven primary care office. So a team approach was used, which, as Dr. Jha noted, can be very helpful, utilizing multiple team members who can share their expertise and also to distribute some of the labor in a very helpful way also, so that we can really do our jobs the best possible. And really thinking outside the box here. There's the common way we think about this often is the pill for every ill. Chris was starting on taking fairly regular sleep aids to help himself fall asleep. And this is so common in our current health system. So offering these integrative medicine tools are really, I would say, a cost-effective, non-pharmacological way of providing good care that's very different from the traditional system. The power of the group. So there's a lot of data on this as well, which I'll talk about in a moment. But groups themselves are quite innovative and can be rewarding and important. And then in this particular case, I, as the primary care physician, providing integrative services that primary care physicians do not commonly offer. And I know there's a couple questions about insurance coverage, which I'll definitely address in just a moment as well. And having the care delivered in this case through an interdisciplinary integrative medicine center is also a highlight of this case, as there are not too many of these centers, although they do exist in certain locations, either independently or affiliated with institutions, both hospital and academic. So just highlighting some of the therapies that we did use with Chris, not going through too much of the evidence, but getting at least a general sense of the benefits and how they can be used. So group visits, here you can see the Agency for Healthcare and Research Quality recommends, as part of their strategy 6M, group visits as a strategy for improving the ambulatory patient experience. There are many benefits associated with group visits that have been demonstrated, including reduced healthcare costs, greater patient and clinician satisfaction, patient empowerment, greater patient compliance, reduced repeat hospital admissions, and fewer emergency room and subspecialist visits. Groups can also be really helpful in terms of being able to deliver it in underserved settings, particularly in any integrative medicine tools. There are some great forums, including from I Am For Us, Integrative Medicine for the Underserved, that really discuss how this can be done in an insurance reimbursable model. All of the groups that we deliver at the Marino Center are done through insurance as the standard way, which is nationally recognized, of using group visits. So they are billed to insurance in the way that we provide them. Group visits are not new. They have been around, at least this model, at least back to 1990, when Dr. John Scott of Kaiser started delivering them. And the other key with groups is really the fact that it's a group. There are other people involved in the care who are, so really the patients. It's not just Dr. Jha and I leading. It's really, we're facilitating is the way that I like to talk about it. And patients really learn from each other. There's a really important benefit of group learning and shared experience that can happen in the groups that doesn't otherwise happen in our typical one-on-one visits. It also gets at another increasing epidemic, which is social isolation, which has been associated with increased morbidity and mortality. So MTPC, mindfulness training in primary care, and other mindfulness-based interventions are one of the main things that we used with Chris as well. MTPC in particular was developed through the Center for Mindfulness and Compassion with the Cambridge Health Alliance. As Dr. Jha mentioned, there was a previous Osher Grand Rounds on the research behind this specifically. The MTPC group visit is based on other mindfulness groups that have already been shown to be effective, and really based on the work of mindfulness-based stress reduction, self-compassion work, and also mindfulness-based cognitive therapy. It incorporates mindfulness, self-compassion, and behavior change skills, which is really key with the primary care piece. And it has been designed in particular to be delivered as an insurance reimbursable visit within the primary care setting, adapted as such, and within diverse community settings. So I won't go through the evidence in detail here, as this was done previously, but there has been very good data, at least some pilots and some good randomized controlled trials showing benefits of MTPC in particular, which we offered with Chris. Cognitive behavioral therapy for insomnia. So here is another of the main therapies that I used with Chris, and really here, this is the first line therapy for insomnia and sleep conditions. As you can see below, this is the most recent guideline from the American Academy of Sleep Medicine. There's a strong recommendation from the GRADE criteria to use multi-component cognitive behavioral therapy for insomnia for the treatment of chronic insomnia disorder in adults. And really, you can see above that it's pretty much recommended by everyone, all the different societies and organizations. So American Academy of Sleep Medicine, American Academy of Family Physicians, and American College of Physicians all do recommend this. And importantly, it's recommended for all types of different insomnia. I saw a recent paper actually with Dr. Gloria Ye with Osher showing the benefits with patients who have breast cancer. There's a lot of other studies showing that it can be helpful for insomnia related to depression, anxiety, and others. And this is something that I also, as far as the insurance question goes, this is something that I do offer as a regular standard office visit, done generally over telemedicine so that we can see each other without masks on, and is covered entirely. Here, the interesting thing too, CBTI is not just effective, it's actually better in many cases than the medications. It's more durable, long lasting, and in some cases more effective when compared to medications, including benzodiazepines and non-benzodiazepine medications. Clinical hypnosis was another tool I offered that, again, I use as part of a standard office visit, so entirely insurance reimbursable. As far as that goes, the evidence here, there's not enough, I will say. There's still a lot in the works. There are some meta-analyses. Here is a systematic review showing that most studies do show benefit of using clinical hypnosis, at least 58.3% here, showing benefit. But really the key here is that there's low incidence of adverse events. So this is something like many of the integrative therapies that we use, where there is potential high benefit. It's very hard to study something like clinical hypnosis or many of the psychological therapies in general to compare to placebo and to randomize because it's often very clear what you're getting. And that makes it more difficult to study. There's also just been a deficit of studies, I would say, in certain outcomes, although that has been changing. But if something is safe, might be effective, that's how we start to decide what we might use. And generally, I use clinical hypnosis for insomnia as an adjunct to CBTI, which I know is extremely well studied and the first line, depending on what comes up through the course of the visit. So with Chris, there was a point where it seemed though that he was using maybe more medication still than we both would have liked. And that he came to me a few months later after we had done both MTPC and cognitive behavioral therapy for insomnia, where he didn't seem, where he seemed to almost relapse, where sleep worsened again. And actually it was coming to me with another separate medical issue, which would only happen in a primary care setting, really, rather than me just seeing him as a consultant. And so that's where the pivot comes in, deciding to change gears. That's where hypnosis came in and it provided another useful adjunct. So as mentioned, Dr. Jha and I both work at the Marino Center for Integrative Health, which is a multidisciplinary integrative medicine center. And it's really one example of how to deliver this type of care, integrating integrative medicine into primary care. So a little bit about the Marino Center where we work. It was initially established independently and philanthropically through Les Marino, and now it's part of the Mount Auburn Hospital System and Beth Israel Lahey Hospital System at large. And it's academically affiliated with Harvard Medical School. Both Dr. Jha and myself are on faculty as instructors. So some of the things that we offer, the services we offer at the Marino Center are important here just to get a sense of how this can be done in an integrated way at an interdisciplinary center. So we offer many different services, including primary care, integrative medicine consults, which I provide, as does another provider here as well. So that we can get referrals actually for those from other providers within our network. Functional and holistic medicine consults, which are provided here as well, a slightly more alternative approach that can be used and can be helpful in many cases. Clinical hypnosis, as mentioned, as I provide. Acupuncture and traditional Chinese medicine, we have a licensed acupuncturist that works with us. Medical acupuncture from physicians, which I and another physician at the Marino Center also provide. We also provide medical massage and craniosacral therapy, chiropractic, integrated nutrition, cognitive behavioral therapy for insomnia, chronic pain, and other mental health conditions. And then our group visits, which I'm probably the most proud about and the most excited about, in particular for expansion. Right now offering these 3 different groups for mindfulness training in primary care, mindfulness-based cognitive therapy for depression and anxiety relapse, and lifestyle medicine group visits. So there were really different models of being able to offer integrative medicine services within the health system. There's not necessarily one perfect approach for this. So the first is having, say, an interprofessional integrative medicine center, such as the Marino Center that Dr. Jha and I work at. There's also the consultative model, as mentioned, that we provide, although integrated with the interdisciplinary group. But there are many integrative providers, as it is a subspecialty in and of its own with board certification, where that's what they provide. This is their specialty. They provide integrative medicine consults for, say, hypertension or stress, or integrative approach to something else, or something that has potentially been unexplained or difficult to manage in a conventional setting, like, say, chronic fatigue syndrome, or chronic pain conditions, which can often require a multidisciplinary approach. So looking at it with different eyes using non-pharmacological means can really be helpful in many cases. And this is something that I do provide as well. Integrative primary care model. So mostly focusing on the primary care physicians and providers themselves being able to provide integrative primary care, not necessarily with a whole multidisciplinary team. So this can be done solo, private, group, or even in federally qualified health centers. So using lower or underinsured or uninsured patients, which I have experienced delivering this in the past. As I mentioned, group visits often can play a big role here in terms of being able to access this and to get insurance coverage. Hospital or academic, so the Marino Center is kind of a hybrid with that, and that we're an integrative center and also part of the hospital and academic. There are even inpatient models as well. So we mostly focus on the outpatient, but say UCLA, they have an inpatient integrative medicine service focusing on East-West medicine. Where I did my fellowship, they have acupuncturists that work inpatient and a fellowship for that specifically, where there can be tools and options for integrative therapies incorporated. There can be collaborative but separate treatments, including centers without walls, such as the clinical centers with the Osher Center, of which Marino Center is a part. And really still using your resources that you have, that you know of in your community, to be able to offer integrative therapies if you are in primary care, really having referral networks in place and people that you can collaborate with. And then there are, of course, standalone integrative specialty treatments, which is a little bit more disjointed, but definitely plays a role as well. Our community practitioners, acupuncturists, chiropractors, Ayurvedic medicine, many others as well, Reiki, that can be useful adjuncts that patients often seek out themselves, although that primary care physicians, it would be helpful if they can develop some familiarity too with what's available even within their own communities and what has been shown to be helpful for their patients. So we discussed the problems at the beginning, went through the case with Chris and Dr. Jha. And so what are some of the solutions? Where can we go with this based on some of the things that we've discussed today? So the first is to prioritize primary care. Really, primary care plays such an important role within the health system. The benefits are so clear internationally, and rather than deprioritize primary care financially and systemically, changes need to occur. Integrating integrative medicine is my other recommendation here. And now, does that mean that all primary care physicians should be doing fellowship certification in integrative medicine and delivering the complementary or non-pharmacological modalities themselves? I would say absolutely not. Really, the way that I see this working more from a systemic level is similar to the way that, say, collaborative care models and integrative care are now working and being increased for mental health services. So to really involve integrative medicine within the health system, to integrate it in a way that's helpful, where these services are readily available, insurance reimbursed and covered, so that they can be very clearly offered. And then, of course, increasing the education for both providers, patients, and the community about the benefits of integrative therapies. And thinking creatively about how to do this. There's many different ways to do this, many different models, as I just mentioned, of being able to do this. Of course, I think group visits are a great model for being able to expand and offer integrative medicine in a way to reach more people. Collaboration and interprofessionalism. So really important to take into account everyone's expertise within the integrative medicine and health system to be able to get the health of our population to be better and to use integrative medicine in a way that makes the most sense. Groups, as mentioned, can be a powerful way to bring to bring patients together in their healing journey. And then there is need for advocacy here. Things do need to change, but the future is bright. There's many different options available, and primary care and integrative medicine are the way, as far as I'm concerned, at least. So thank you both, Chris and Dr. Jha, for joining us in the discussion today. And thank you everyone else for tuning in. And I will leave this open to questions now.
Okay, thank you, Michael. Thank you, Chris and Dr. Jha as well for being here. If we can just unshare your screen, Michael, you can have all of us. Perfect, great. Okay, well, there are a bunch of questions, so let me get right to it. First one, actually, I'm going to invite Chris, if we can spotlight, if we can spotlight Chris and Neeti as well. So I'm just curious, Chris, in your journey, you had presumably had seen a sleep medicine specialist at some point. Was CBTI ever offered as a possibility prior to sort of working with this team? And it's just interesting that given the evidence and you had seen a sleep specialist, was that even a consideration at any point?
No, I hadn't. And after all that effort of staying overnight in the center and being all wired up and going through that study, I was surprised to not be led to any other CBTI type program. I just don't remember it being offered, and it was sort of a shoulder shrug, and then time and space sort of came into play there, and I wasn't pressing them for any answers either. But yeah, since I wasn't being led, I don't think that ever came to pass.
And just if you had, if Michael or Neeti, if you want to just add anything that you've observed in your clinical experience as a provider, how often evidence, like even though the evidence is quite supportive, has that been often left behind? Maybe it's the right way to ask it.
Yeah, I can definitely speak to that, at least as my experience as a primary care physician. It's very difficult to access, often even in training, which is why I think these guidelines are very important. What we're told is sleep hygiene, which doesn't really have very good evidence. And that's something that's pretty much the only thing that I find that physicians and even sleep specialists are often able to provide without being able to work with usually a psychologist, a sleep psychologist who has experience, or a behavioralist with CBTI. So even though that's what the evidence shows, it's very hard to access, and it's even not brought up a lot of the time, or it is in passing without being able to offer it. Even within our center, I actually mostly get consults from other providers, even sometimes from our sleep center, to be able to offer that, because it's just otherwise not readily available, or there are no slots for it.
Okay, great, thank you. We have several questions, and both for Neeti and Michael on this front. The group visits, how are they covered by insurance is a big question here. Is it covered, and how do you get, when you deliver these group visits, how is that done? So maybe start with Neeti, and then Michael, if you want to add on to it.
All our group visits are covered by insurance. Most insurances cover these visits, and they are billed. We bill level 3 and billing for content, and we document each visit every week, and we have not had any issues with the billing. All the lifestyle medicine, mindful therapy, mindfulness training for primary care, all go through the insurance. They are covered by insurance, which is what makes it more accessible for all our patients, because during the pandemic, especially with things like therapy, people don't have access to mental health providers. And the emphasis now is to integrate these things with primary care settings. And because it's covered by insurance, the access is good, people are able to connect, and there is this power of common humanity. People are seeing the suffering. So we love doing this, and we love the fact that insurances are opening up and covering these visits.
Yeah, thanks, Dr. Jha. And just to add to that too, as far as how that's done, so it's not like we necessarily reinvented the wheel on this either. We really went off of what the national model is for group visits, to be able to offer them this way as office visits. And there's a lot of tools. There's some organizations, including IM4S, as I mentioned, that discuss the how-to of how to do this. AAFP, American Academy of Family Physicians, also has a nice how-to, and BILH, where we work now, actually offers services for being able to set up your group visits and how to bill, how to document them appropriately.
Another question, just thinking about other components in sort of as we think about an integrative approach, and just curious as to if it is offered at the Marino Center. Chris, in your experience, have you been offered approaches like yoga or Tai Chi that also may, like a mind-body approach that also may support sort of your sleep health as well?
I've not considered those yet. I've heard about them and haven't really discussed it yet with Dr. Spertus. We've been pretty focused in the last year on CBTI and mindfulness, and that's been pretty effective. And I believe I'd be open to other integrative approaches if those were deemed beneficial, and Dr. Spertus would want to take that path. Otherwise, I've been doing some Qigong on the side, so I guess an element within Qigong is Tai Chi, and so those are related, and so I've been finding that helpful as well on my own.
Yeah, and just to add to that too, that really speaks to how to choose what types of things, because oftentimes, I might see someone even for a consult or one of my own primary care patients for insomnia, and I do recommend restorative yoga, or a lot of patients, or Tai Chi, which actually has equivalent evidence in some cases, especially for cancer patients. So it really depends where you're at as a patient, and coming to that decision together, I would say, is really how that process really happens. And many people, especially to the Marino Center already, since it's known to be integrative health, come in doing a lot of yoga or Tai Chi like you are, Chris, already. And so that also adjusts how we're going to go about the process.
And I might just add that some of our groups, our mindfulness groups, do address mindful movement. So we do bring in mindful movement in some of our groups. And we have thought about expanding our groups and including a separate mindful movement, but it's still in the works. We haven't put it out yet.
And then just one question before we wrap up. Just thinking about the, Michael, your family medicine trained, the pediatric population. How have you thought about some of these approaches in the pediatric side?
Yeah, that's a great question, and one that's harder for me to answer now, since I'm not actually seeing pediatrics as I work in internal medicine right now. Though that said, I know that when I was doing this more in a family medicine center, that is an option. I would even see consults and primary care patients that would offer integrative therapies for, in a very similar way. And the only difference is that you're working generally with the patient and their parents, and really focusing on lower risk types of things. So generally, lower on the supplements and things that you can give, and higher on mind-body types of therapies.
I just want to take away, we're right at the hour. I know there are several questions. Michael, if those that want to, didn't feel their question got answered, please reach out to us at the Osher Center. We're happy to forward them to Michael and Neeti accordingly. So don't feel like this is it. And we'll definitely love, there's a lot of discussion, as you can see in the Q&A and chat, and really grateful. Thank you. Chris, thank you for really sharing your story with us. It's a tremendous honor to have patients share their journey because we learn quite a bit as providers. And Neeti, again, thank you for all your work that you're doing, and we're really grateful. And Michael, of course, sort of bringing this group together. So really wonderful presentation. To all our audience, thank you for being here. Just as a reminder, next month we will have Clinical Neurospirituality by Dr. Michael Ferguson be our presentation. And then again, stay tuned for our network forum. Amazing, last year we had 700 registrants, so not to be missed. and it'll be on the lived experience of depression. Again, really taking this from a multimodal integrative medicine perspective. So thank you, everyone, and we will see you next month. Be well.